सर महेश का एक है केस तो
हाँ हाँ
स्टार्ट करो।
हाँ हाँ बोलो। हाँ
A 29-year-old woman was admitted to the hospital because of fever and increasing abdominal pain. The patient had spastic quadriplegia due to cerebral palsy, but had been in her usual state of health until approximately 2 weeks before admission, when intermittent fevers with temperature up to 37.7 degrees developed. One day before admission, pain in the left flank and left lower quadrant developed, and she noted foul smelling urine. During the night before admission, the oral temperature rose to 39.1 degrees Celsius, associated with nausea and pain in the chest, both legs and the abdomen, which radiated to the back, both flanks, and the mid-scapular region. She took ibuprofen and her parents brought her to the emergency department at this hospital in the early afternoon. The patient rated the pain at 8 on the scale of 1 to 10, with 10 indicating the most severe pain. She had cerebral palsy with spastic quadriplegia, obesity, iron deficiency anemia, polycystic ovarian syndrome with irregular menses, recurrent UTI, and nephrolithiasis. A ureteral stent had been placed temporarily 10 years earlier because of an obstructive stone in the left ureter. She drank alcohol socially, did not smoke or use illicit drugs. She lived with her parents and sibling in urban area, recently broken up with her boyfriend. She used a wheelchair and required assistance when cutting food. She followed a low oxalate diet.
so now if we stop here, huh? So it's a middle-aged lady
Yes, sir.
or young lady who's come with fever, abdominal pain, mainly in the left flank
Yes, sir. Left flank
and
and left lower quadrant.
left lower quadrant, and she has a history of nephrolithiasis.
There is spastic quadriplegia on wheelchair, cerebral palsy due to cerebral
हाँ
palsy.
वो सब तो है ना. I'm telling you the relevant things.
Yes,
ठीक है.
sir.
So she has history of nephrolithiasis
Yes, sir.
and recurrent UTIs.
Yes, sir.
बराबर. And she has a stent being placed in the ureteral stent,
Yes, sir. Yes,
which was done around 10 years ago.
yes, sir.
yes sir.
बराबर. So now this is a young lady who has come with fever, left flank pain, left lower quadrant pain, and has a stent in situ. Barabar. She also they said foul smelling urine.
Yes,
That
sir.
may or may not be significant, but putting all this in consideration, what do you think?
So it can be again an attack of pyelonephritis or a ureteric stone.
So my right now the first diagnosis that comes to mind is a complicated UTI,
Yes.
probably a stent infection or something, because stents usually need to be removed after 6 weeks. Na? If they are staying in for a very long time, then there can be biofilm formation and they can get badly infected. Correct?
Yes sir.
तो बोलो. So what else do you think? Is there anything else which comes to mind?
So in the female of middle age reproductive age group can be an ovarian lesion, fever, abdominal pain.
But what lesion? Ovarian torsion will cause pain but not fever. बराबर. What else? Salpingitis it can be.
Meningitis, yes.
Salpingitis it can be. But other thing is in colitis.
Colitis.
Descending colon colitis. But look, they all look unlikely. What looks most likely is urinary infection, mainly complicated stent infection seems to be the most likely. Okay, bolo.
She reported no contact with sick person and no exposure to ticks. She was not sexually active. Her father and paternal grandfather had diabetes mellitus. Her father had reactive arthritis, and one grandfather had relapsing polychondritis, and two grandparents had coronary artery disease. On examination,
Okay.
the patient who was in a wheelchair was alert and communicative. Temperature was 37.5. Blood pressure 119 by 63 millimeter of mercury. Pulse was 108 beats per minute. And oxygen saturation 96% while she was breathing ambient air. There was mild
Okay.
tenderness of the sternum, which was reproduced with deep inspiration and tenderness of the left costovertebral angle. The abdomen was soft and tender to palpation on the left side, with the most severe tenderness in the left lower quadrant. There was no rebound or guarding. Radial pulse were 2 plus. The remainder of the examination was consistent with spastic quadriplegia.
Okay.
Examination.
Hmm.
Investigations. The platelet
Hmm.
count and the level of serum electrolytes, glucose, calcium, phosphorus, magnesium, total protein, albumin, globulin, amylase, and lipase were normal, as were also the test of renal function. Other tests are
Okay.
shown in table 1. So in
Hmm.
CBC, the progressive CBC from admission to day 7, there was a drop in hemoglobin from 11.4 to 8.5.
Hmm.
The WBC count stayed in the normal range from 6,500 to 9,600, but the lymphocytes were on the higher increasing range from 35 on admission to 58 on day 7,
Hmm.
with the retic count of 3.7% on the day 7. Otherwise,
Okay.
PTI are normal. Bilirubin, sir, was showing increasing trend with total bilirubin of 3.1 on 7th day with a more of direct 2. 2. And
Okay.
LFTs were deranged. Uh, on admission, it were normal 38 and 43. But on day 7, the alanine aminotransferase was 202 and aspartate aminotransferase was 304. Alk phos was
Hmm.
170. LDH was 598. CRP 75.6. Celluloplasmin 53. Antibody to smooth muscle positive at 1:40 dilution. And IgM and IgG anti-cardiolipin antibody positive.
Okay. So if we see this now, completely the picture has changed, right? So if you are expecting UTI, colitis, or salpingitis, you would expect neutrophilic leukocytosis, something like that. But इसमें सब liver का आया हुआ है.
Liver and
That is not correlating with the signs and symptoms actually, but sometimes that may happen. बराबर. So there is high bilirubin, there is high OTPT,
yes, sir.
and some antibodies are positive. Correct. ASMA antibody is positive and cardiolipin antibody is positive.
Yes, sir.
बराबर.
Yes, sir.
And ceruloplasmin का normal level क्या है भाई?
Sir, 27 to 50, इसमें 53 दिया ना. थोड़ा सा
Okay.
high.
So ceruloplasmin is low. Huh? So now another thing we have to pay attention to is that there is a
53 था, 50.
53 is what?
Range is 27 to 50 milligram per deciliter.
Acha, so it is higher than the range.
Yes, sir, on the higher of the upper normal range.
Okay, understood. So see, the other thing you have to note here is that there is a what seems to be a significant sudden drop in hemoglobin
Yes, sir.
with a rising retic.
Yes, sir.
Okay.
LDH.
So now this, one second. This is very interesting because if you get a hemolytic anemia in a reasonably young patient, right, with a liver abnormalities, then you have to think of जिसको आंसर आता है वो बोलो, मतलब जिसने डायग्नोसिस देख लिया है वो मत बोलो. तुमने सबने देख लिया क्या?
नहीं सर,
ये
मैंने
दूसरा केस है. ये दूसरा केस.
बराबर है, ये दूसरा केस है, बट किसी ने डायग्नोसिस देखा है कि नहीं?
हो गया.
मैंने देखा, इन्होंने नहीं देखा.
हाँ, किसने
प्रैक्टिस
देखा
हो
है?
गया.
सिर्फ मैंने देखा सर, मैंने पार्ट से टाइम एक रीड किया था पूरा.
बाकी बाकी लोगों ने नहीं देखा ना. हाँ,
नहीं सर,
तो वो
नहीं.
बाकी लोग आंसर करो.
Sir,
हेमोलाइटिक
actually we
एनीमिया
joined late, so we missed the presenting symptom.
हाँ
Mahesh, can you
इसका
summarize,
एक
please?
एक क्विक रिकैप कर भाई.
Yes, sir. 29-year-old female in the background history of spastic quadriplegia and past history of nephrolithiasis, a ureteral stent placed 10 years back, and history of recurrent UTI, now presenting with fever and abdominal pain, mostly localized to the left lower quadrant. And no history of any contact with sick person, no exposure to take. The vitals okay, and on abdominal examination, deep tenderness on the most severe tenderness in the left lower quadrant, no rebound or no guarding. So presenting symptom is fever with abdominal pain in the left or lower quadrant. And the investigation में
इन्वेस्टिगेशन तो सुना ना आपने.
हाँ सर, बट वो कोरिलेट नहीं हुआ क्योंकि हिस्ट्री नहीं पता था.
ओके तो मैं बोलता हूँ. देखो, young lady has come with fever, abdominal pain on the left side, and history of ureteral stent being placed 10 years ago. Okay. So just based on history, we were thinking UTI, maybe stent infection and all that. Okay. But then now in the CBC, we found very strange things. Create electrolyte is normal. There is normal count, no leukocytosis. And in fact, there was a hemolytic anemia type of thing. Hemoglobin was 11. Initially, वो हो गया सीधा 8.5 with a rising retic count, right? And there was a hepatitis, hyperbilirubinemia, mainly direct, and raised OTPT and alphos. Okay, and some antibodies have come positive, ASMA and cardiolipin. Okay, so now the whole picture is young lady, fever, abdominal pain, a normal total count, but hepatitis is there and antibodies are positive. So now what will be your differential?
So viral hepatitis probably, but that won't explain hemolytic anemia. Viral
Why? Autoimmune, you're saying autoimmune?
autoimmune possibly.
Autoimmune hemolytic anemia with
Left hypochondria.
Huh?
So the pain is left hypochondrium, no?
Yeah, that is the strange part. Patient is
Can
having
be
a
something related to
hepatitis.
spleen.
spleen also.
Lower quadrant.
Testicle anemia.
Left lower quadrant.
Huh.
Left lower quadrant. Left lower quadrant.
spleen का पेन हो सकता है.
Just 1 second. Huh?
Yes.
बस लूज मोशंस एंड वो सब का कुछ हिस्ट्री है क्या?
किसका हिस्ट्री?
महेश,
हाँ,
लूज
loose
मोशन
motions.
वगैरह कुछ है क्या?
नहीं लूज मोशन का नहीं मेंशन नहीं किया कुछ उन्होंने. सिर्फ
जर्नल से रीड कर रहे हैं.
जर्नल से हाँ.
फाउल स्मेलिंग यूरिन
एंड
है.
मेंस्ट्रुअल हिस्ट्री इज ओके.
ये हाँ मेंस्ट्रुअल हिस्ट्री,
PCOS है with irregular menses.
नो सेक्सुअल एक्टिविटीज.
PID.
पीआईडी का कुछ बहुत
बट काउंट्स आर ओके, सो आई विल इट बी.
Yeah, so see, based on
आसमा इज पॉसिबल.
But अगर PID है तो hemolytic anemia doesn't fit.
yeah, see, based on history, based on purely history, our first differentials were UTI, salpingitis, ovarian torsion, and descending colitis.
Yes, sir.
Barabar. Of course, we can add PID and diverticulitis in that, but age group for diverticulitis is generally older. Salpingitis, PID are possible. Okay. So this was what our initial diagnosis was on the history. But after the investigation, there are a completely new set of diagnostic possibilities have opened up. So you are saying viral hepatitis, other people are saying autoimmune hepatitis. Anything else on your mind? Huh? Sorry? Possible. Hmm?
Sir, some type of infection involving the liver and the spleen. When because of that spleen, she is having some left quadrant pain.
Left quadrant.
No, left quadrant.
So you are. So firstly, I want to say why I was laughing when Abhishek said viral hepatitis. I was laughing because viral hepatitis NEJM case नहीं बनेगा. So that is kind of ruled out in that way. Clinically, of course, it's always possible. ठीक है. So the other thing I want you guys to think is see, this is a relatively young lady, 30-year-old. So she is in the age group for autoimmune problems, and this can be the first episode of her autoimmune problem. But generally, of course, और history में आगे आगे कुछ बताते कि नहीं देखते हैं. But generally in the autoimmune disorders, you will not be catching the first episode. Means you will be catching after 2-3 episodes have occurred, or second or third episode, something like that. So you may have a history of something similar in the past. वैसा इसमें तो कुछ बोला नहीं है. So it's a small kind of very soft point against autoimmunity. But just keep it in mind. It can obviously always be the first episode of autoimmunity. And it's also possible that we have not had enough time to take a good detailed past history in which the patient has experienced similar things in the past. Okay. But what I want you to kind of also understand is that this combination of hemolytic anemia and hepatitis is not very common. It is relatively rare. There are, I think, very few things which can cause it. So see, like a pure hemolytic anemia would actually not cause too much of OTPT rise. It would only cause hyperbilirubinemia along with the hemolytic anemia. बराबर. But OTPT increased है ना, तो वो उसका differential और कम हो जाता है. ठीक है. I have something in my mind. I'll give you a hint. Let me see if you guys can kind of come to it yourself. ठीक है. If you gave me a choice to examine her and told me you can examine only one thing, what organ would I examine? Sir, I'll tell you what I'll examine, then you tell me what I'm thinking. I would examine the eye.
It's a
Wilson's disease.
hepatitis.
Correct. You're right. I'm thinking Wilson's disease because I'm looking for the which ring?
Kaiser-Fleischer ring.
Kaiser-Fleischer ring, right? Because Wilson's disease is one of the classic causes for a concomitant hemolytic anemia along with a hepatitis.
Yes, sir.
बराबर. हाँ? अब उसका मैकेनिज्म मैं थोड़ा भूल गया हूँ. मेरे को याद आया तो बताता हूँ. But I just remember this fact. Hemolytic anemia in a young person and you can't find anything. You can have this thing. Okay. Wilson's disease. And of course, copper deposition in the liver causes the hepatitis. Okay. The other name is also hepatolenticular degeneration, where there can be copper deposition in the basal ganglia, which will cause Parkinsonian features. So in a young patient, if you have Parkinsonian features, then there are two main things. So one is Wilson's disease, correct?
Yes, sir.
Second is toxoplasmosis. Because like we discussed in the CNS cases in HIV, toxo has a predilection for the basal ganglia. So young patient may come with a Parkinsonian features that will be either Wilson's or toxoplasmosis. Okay. हाँ, and hemolytic anemia के तो बहुत सारे causes हैं, but उसमें अगर कुछ नहीं मिल रहा है तो you have to always consider Wilson's. Another thing is hepatitis. Patient is having hepatitis and you worked up all possible things. सारे antibody कर लिए, सारे viral markers कर लिए, कुछ नहीं मिला तो last दो बचते हैं CMV and Wilson's. Okay, so keep this in mind. ये 3-4 differential में Wilson आता है. Unexplained hemolysis, unexplained hepatitis, and young Parkinson's. Okay, so right now that is on my mind. Okay, of course we don't know for sure, but I would definitely consider it as a differential in this patient with hemolytic anemia, fever, and hepatitis. Okay, it's possible that it's a autoimmune thing and Wilson is not there, but let's see आगे क्या बोलते हैं. At this juncture, Wilson is definitely a possibility. Okay. बोलो आगे बोलो.
Review of the peripheral blood smear revealed anisocytosis, polychromatocytosis, hypochromatocytosis, and microcytosis. Urine analysis revealed clear amber urine with a specific gravity of 1.025, pH of 6, 2 plus bilirubin, 1 plus protein, and a trace amounts of ketone and urobilinogen. Culture was sterile. Investigation. While the patient was in the emergency department, narcotic analgesia was administered IV and her pain was decreased to a score of 7 out of 10. 8 hours after the arrival, the patient vomited once. Ondansetron was admitted. CT of the abdomen was performed after the oral and the IV administration of contrast material, but it was complicated by extravasation of the contrast material at the IV site in the right arm. The study showed malrotation of the left extrarenal pelvis, multiple cortical defects in the left kidney that were consistent with scarring, and a urinary catheter in the urethra. The spleen was mildly enlarged, 14.8 centimeter in the craniocaudal dimension, upper limit of the normal range 12 to 13. There were prominent periportal, mesenteric, inguinal, and retroperitoneal lymph nodes up to 1.4 centimeter in diameter, with trace free fluid in the pelvis. The patient was admitted to the hospital early the next morning.
So stop here.
Yes,
What they are saying is that एक तो उन लोगों ने contrast extravasate कर दिया
yes,
in the arm, which can be a medical legal problem. Second, they mentioned malrotation of the left kidney.
malrotation of the left extrarenal pelvis.
Extrarenal pelvis. Or there's a malrotation of the extrarenal pelvis. Means क्या क्या malrotate हो गया मेरे को समझा ही नहीं. My anatomy is poor, of course. थोड़ा पढ़ते हैं बाद में. दूसरा क्या बोले वो left kidney is scarred.
Yes, sir. Multiple cortical defects in the left kidney that were consistent with scarring.
Okay, that we kind of expected because she's having long-standing lithiasis and that stent and all that is there. That means थोड़ा infection हो के scarring हुआ रहेगा. ठीक है. बाकी क्या बोले? Cyst कहाँ पे थे? Cyst?
Spleen was mildly enlarged and lymph nodes, multiple prominent periportal, inguinal, and retroperitoneal.
Yeah. So lymphadenopathy is suggesting some sort of pelvic infection, but not clear. ठीक है. आगे बढ़ो. हाँ.
Admission. On the day of admission, the temperature was 38.1 degrees Celsius. The pain, as rated 8 out of 10, persisted and narcotic analgesia was administered IV. Nausea and vomiting recurred, but less than after the administration of prochlorperazine. Treatment with dalteparin sodium was begun. Repeat culture of the urine grew rare mixed bacteria. The chest radiograph showed low lung volumes and no opacity that were suggestive of pneumonia. The next day, USG of the kidney and the venous system of the lower extremities was normal, with no evidence of hydronephrosis of DVT. During the 3rd, 4th, and 5th hospital days, The serum iron binding capacity and levels of iron, ferritin, folate, and vitamin B12 were normal. Other laboratory test result as shown in the table 1. On the third day, the temperature rose to 38.5 degrees Celsius. Urine analysis now revealed leukocytes more than 100 white WBCs per high power field, and a urine culture grew Proteus mirabilis and Escherichia coli. Blood culture remained sterile.
त्या आवाज ब्रेक हुआ रे
Yes, sir. वो
कॉल आया
call
कनेक्शन नो प्रॉब्लम
So, sir, urine culture grew Proteus mirabilis and E. coli. Blood culture remained sterile. Ciprofloxacin was administered. The next day, a cherry red rash developed on the patient's feet and resolved spontaneously after several hours. USG of the abdomen was normal. Low-grade fevers occurred intermittently thereafter, and severe abdominal pain also persisted. It was greatest in the left upper quadrant with radiation to the left flank and was associated with nausea and intermittent vomiting.
तो अभी अपर हो गया पेन पहले लोअर था
Yes, sir.
अभी अपर बोल रहे ना
Greatest in the left upper quadrant with radiation to left flank.
बराबर बोलो आगे बोलो
On the fifth day, testing for antibodies to Borrelia, CMV, and hepatitis B and C viruses was negative, as were tests for antinuclear antibodies, CMV, antigenemia, and neutrophil antibody. A CT scan of the abdomen after the IV administration of the contrast material showed persistent mild splenomegaly with peripheral wedge-shaped area of hypoattenuation that were consistent with infarcts. Other findings unchanged from the CT performed on the day of admission. Test for malaria and antibodies to HIV and heparin factor 4 were negative. Sorry.
रुक जा हाँ so now in the new scan they have found an infarct on the left side
Spleen.
on the spleen
Yes.
हाँ so now what do you think is the differential
Spleen infarct, hemolytic anemia, sickle. Sir,
हाँ बोलो
sir, hemolytic anemia and splenic infarct seen in sickling phenomenon.
yes possible but वो peripheral smear में अब तक उनको दिख जाना चाहिए था
Yes, sir.
it's possible
And is sir.
और क्या हो सकता है
Sir, infective endocarditis causing embolic phenomenon of causing spleen.
yeah again possible but this is generally not the patient profile because she is not having any prior heart disease and she is relatively young and I think she's not a IV drug user
Not a drug use.
हाँ possible but अभी तक तो लगता नहीं है फिर what else anybody see I'm thinking she is having a 8 out of 10 abdominal pain
Yes, sir.
very severe barabar but
Yes,
first
sir.
imaging was normal second imaging showing some small infarct barabar so the signs I mean the symptoms are much greater than the signs
Yes, sir.
barabar so when that happens there's a possibility of mesenteric ischemia barabar so mesenteric ischemia again she's not the patient profile usually it would happen in elderly with atherosclerosis but it can also happen in patients with connective tissue disorders and vasculitis barabar
Yes.
so that is kind of presence of a splenic infarct and possibility of mesenteric ischemia along with this picture of hepatitis and hemolytic anemia is all pointing towards a little bit of autoimmunity or a vasculitis बराबर इतना सब systems involve हो रहा है या middle age lady में young lady में and we are getting vascular events in a young patient. So either there is an accelerated atherosclerosis, or there is some thromboembolic phenomenon, or there is a vasculitis. Barabar. So all these are kind of, except for accelerated atherosclerosis, the other two happen in connective tissue disorders, autoimmunity. Barabar. Accelerated atherosclerosis would happen in a patient with a sort of hereditary hyperlipidemia and heavy diabetes or something like that. वो तो नहीं लगता है इसको, है ना?
Yes, sir.
ठीक है? So some sort of hemolytic anemia which will cause bleeding infarcts is possible, but little lesser. And what else you mentioned? Endocarditis again possible, but I would keep it lower. My first diagnosis now would be some sort of autoimmune problem with vascular phenomenon. Of course, Wilson's we keep it in the mind. हाँ, ठीक है?
Yes, sir.
बढ़ो आगे बढ़ो. हाँ.
So tests for malaria and antibodies to HIV and heparin platelet factor 4 were negative, as well nucleic acid testing for Ehrlichia, Coombs direct antibody test, cold agglutinin screening and testing for lupus anticoagulant. Hemoglobin electrophoresis.
कार्डियोलिपिन ऑलरेडी पॉजिटिव है ना उसका.
हाँ सर.
डे 1 पे किया था वो.
ICC दोनों. हाँ.
Day 7.
ASMA एंड कार्डियोलिपिन दोनों पॉजिटिव है.
Yes, sir.
Just keep that in mind. हाँ.
And hemoglobin electrophoresis levels of fibrinogen, homocysteine, lipoprotein, beta-2 glycoprotein 1, antithrombin 3, and protein C were normal.
Okay, so
Other tests as shown in table 1. Blood culture still remains sterile. Transthoracic echocardiography was normal with no evidence of valvular vegetations.
Okay.
On the 10th day, diagnostic test results were received.
हाँ.
फिर इसके बाद फिर डिफरेंशियल डायग्नोसिस में हम लोग ने ऐसा डायग्नोसिस.
बराबर.
ठीक है.
अभी रुको. So firstly, I think our differentials are autoimmunity plus minus Wilson's disease, possibility of some hemolytic anemia, and endocarditis. Okay. Now, what could be the diagnostic test that they performed? I feel they might have done a liver biopsy or some Wilson's वाला कोई टेस्ट होता रहेगा तो वो करें क्या रहेगा, serum copper या कुछ. Do you guys have any other thoughts? या कोई एंटीबॉडी टेस्ट किया रहेगा एडिशनल फॉर वास्कुलाइटिस और समथिंग. और another rare possibility is they might have done a DSA, abdominal DSA, to look at the vasculature and all that.
Yes, sir.
हाँ? क्या लगता है तुमको? Are you guys having any other thoughts? तो बोलो. हाँ, बिंदास.
This is more primarily autoimmune with vasculitis.
हाँ, autoimmune ही लग रहा है possibly. So कुछ
second. Sir, इसको फिर UTI.
हाँ.
UTI तो शायद वो है because of catheter related है, तो उसको urinary catheter भी है.
यूरिन कुछ होएगा साथ में, concomitant urine might be something there, but it will not explain the splenic infarct, will not explain the abdominal pain too much, will not explain the hemolytic anemia nor the hepatitis.
Yes.
तो वो सब रहेगा, means there may be mixture of things. Okay.
Okay.
और दूसरा क्या है कि यूरिन कल्चर में जब मिक्स्ड फ्लोरा आता है ना, तो दैट इज कंसिडर्ड एज अ नेगेटिव. मींस इट्स लाइक अ कंटामिनेटेड सैंपल. उन्होंने कल्चर में ये बोला ना, मिक्स्ड बैक्टीरिया वाज ग्रोन. यूजुअली यू हैव टू इग्नोर इट एंड रिपीट द सैंपल. हाँ, जो मिड स्ट्रीम सैंपल हमेशा अपन बाहर करते हैं ना, तो व्हेन द सैंपल इज एक्चुअली नॉट टेकन मिड स्ट्रीम, पहला ही ले लिया, डाउन स्ट्रीम सैंपल ही ले लिया, तो बाहर का सब बैक्टीरिया, स्किन का बैक्टीरिया आ जाता है उसमें. So you may get multiple bacteria and then it's actually not a good sample. You're supposed to repeat the sample. ठीक है? Okay. ठीक है, बोलो.
Headings नहीं इसमें. ये है heading. इसके अंदर का पढ़िए.
सर इसमें ऐसा वो डायलॉग दिया है डॉक्टर्स के बीच, तो वो ऐसे
हाँ वो तो अभी डिफरेंशियल, पहले पूरा डिफरेंशियल बोलेंगे बहुत टाइम के लिए,
हाँ
एंड में वो डायग्नोस्टिक टेस्ट क्या परफॉर्म किया बताएंगे, तो वो बोलो ना।
एक मिनट ये
अभी डिस्कशन तो अपन अलग फिर अलग से करेंगे.
हाँ
We'll go through what they've enumerated as differentials also, but let's first find out ना. अभी तुम लोग इतना सस्पेंस कर रहे हो ना.
सर इन्होंने दो टेबल्स दिए डिफरेंशियल डायग्नोसिस में, वन इज ऑफ
वो
कॉजेज ऑफ
बाद में करते हैं ना, वो बाद में करते हैं ना. मुझे डायग्नोसिस बोलना अभी. डायग्नोस्टिक टेस्ट क्या किया, डायग्नोसिस क्या आया, ये बोलना. डिफरेंशियल अपन डिस्कस करते हैं ना बाद में.
यार कोई कैसे बोलते हैं?
ये सब क्या, ये तुम लोग क्या, ये किसने सिखाया ये सब सस्पेंस तुमको?
सर
तुम लोग ज्यादा हिचकॉक मूवी देख के आए
डायग्नोस्टिक
क्या?
टेस्ट वो जो डे 10 का वो लोग बोल रहे वो मेंशन मिल नहीं रहा।
हमने मेंशन ही नहीं किया
अरे तो
आगे।
छोड़, एंड में डायग्नोसिस बोलना अभी.
सर एक्यूट एप्स्टीन बार वायरल इंफेक्शन।
एप्स्टीन बार वायरस।
हाँ, माय गॉड. तो सब गूगली हो गया, पोपट हो गया आज अपना. पहली बार हमारा डायग्नोसिस गलत हुआ ये वाले डिस्कशंस में. ईबीवी,
ईबीवी, acute EBV infection सर।
acute EBV infection. Okay. What was the diagnostic test? EBV viral load या EBV serology किया रहेगा या peripheral smear किया रहेगा. Usually those are the things. So actually I should have mentioned, it didn't strike me. So unexplained hepatitis में EBV CMV दोनों आते हैं, not just CMV. And in general जब भी तुम differential बोलते हैं ना, हाँ, तो CMV जब भी बोला तभी EBV भी बोल ही देने का. Everything that EBV causes CMV can cause, and whatever CMV can cause EBV can always cause. ठीक है. जैसा अपन बोले थे ना, टीबी कभी भी आएगा तो एनटीएम साथ में बोल देने का डिफरेंशियल में, वैसे जहाँ पे भी ईबीवी आएगा सीएमवी बोल देने का.
Sir, Miller test on the sixth day they had scanned EBV specific serologic samples and the result were reported 4 days later. IgM antibody against the viral capsid antigen was present and IgG antibody against the viral capsid antigen was absent.
Correct.
IgG.
So see, EBNA is generally indicating old infection. VCA antibodies generally IgM, IgG can tell you whether it is acute EBV or not. Okay. So this they are calling it as acute EBV. Now I still don't know how that explains the splenic infarct actually. तो उसके बारे में कुछ बोला है तो बोलो. बाकी जस्ट टेबल्स, डिफरेंशियल टेबल्स बोलना है तो बोल दो. बाकी सी हेमोलाइटिक एनीमिया, हेपेटाइटिस, फीवर, all of those things are possible in EBV. Antibodies are little strange to come positive, but हो भी सकते, they may be false positive. ठीक है.
यस सर.
बोलो what explanation they
खत्म हो रहा है, एक नया सेशन
हाँ
होगा.
ठीक है, ठीक है. हाँ
यस.
ओके.
नहीं देखते.